episode of Pharma Face Off is brought to you by
So is this providing new data on what is actually happening as the sales reps are in their sales calls?
Well, it's an interesting perspective on that because, I mean, when you implement something like that, I mean, then doing the call notes and the call recording, I don't know, a week later no longer applies. You're in CLM, I mean, you're capturing information as you speak, I mean, as it happens. So that really tells you something about where that call was made, what was discussed, how it was presented, and everything.
It certainly makes reps more efficient. So if they have the right application, the right CRM tool, it certainly makes them more efficient. They can be ready when their customer is ready. So it is, in essence, it empowers customer-driven interactions, which was not possible before. And that is, especially in a specialty rep setting or a hospital settings, is very important, where the reps are able to have a conversation with the healthcare professional, even when they are walking, from one area of the hospital to another area, which was probably not possible before. So it certainly increases their efficiency a lot.
I think efficiency and relevance are just the two main outcomes from it. Yeah.
I'm curious about that customer engagement issue. The reps have an iPad, the doctors probably have an iPhone, maybe an iPad, maybe both, maybe, how do you manage kind of all of the various things? How do you make sure that kind of this remains sort of a vibrant technology that continues to engage the physician?
Well, I think having, as I mentioned before, having tools that really help the physician with their practice and help them connect with the consumer, with the patient. So it's not just an app or a tool for a drug or medication. It's more for condition or more holistic for the practice. And let's not forget, the patient. 30% of all mobile healthcare searches are done in the waiting room. So the patients in the waiting room, they're on their phone, they're looking for information, they're in the exam room waiting for the doctor. So it just enables them to connect on a common platform.
Yeah, I completely agree with you. I think this is where the industry is missing the boat, like big time, because the adoption of technology in the physician's office is increasing, right? EMR is happening whether the government mandates it or not. I mean, so when the physician and the patient really are interacting, it would be an awful lot better if the patient could come back with diary type information that describes the condition a lot better than words can. You can see facts, you can see details, you can reach better therapeutic decisions, and you can increase the wellness component, right, of managing a patient. So if you want to reduce the healthcare costs, I mean, this is an obvious choice, but nobody's stepping up to the plate and really driving that initiative forward, except maybe some insurers and plans are now beginning to act on those sort of things.
Historically, technology used to be a barrier between the healthcare professionals and the pharma reps because they were either using paper or different technology. But with the adoption of the iPhones and iPads by the healthcare professionals, that barrier is gone. So it's more about, so both the sides are comfortable with the technology. It's now how do you use that to establish better relationship. It has started with digital promotion and closed loop marketing. That is the first phase, but we see a transition where this technology could lead to further innovations, in terms of having new ways of detailing with physicians, or having discussions with physicians, more services that are location-based, using augmented technology, augmented reality that is coming up as part of this new new device. The opportunities are huge. We are just seeing the beginning of it right now.
Well, I started this conversation with kind of pointing out some of the challenges, declining access. I can't imagine how the iPad will actually save the pipeline, but maybe that's somewhere down the road. It sounds to me that the three of you agree that this will actually change the shift for access, that it could actually increase access after years of its decline. Is that really what the three of you seem to be saying?
It certainly provides a huge opportunity for pharma to innovate on a new technology that never existed before. So certainly there is opportunity, and we're sure that working with pharma solution providers like ourselves will be able to provide new and innovative solutions on an ongoing basis.
Yeah, and I agree. And I think it allows the pharma companies to really serve up relevant content in a platform that the physicians are open to and are used to engaging with.
Right. I mean, we're getting conditioned to immediate response, right? I mean, you want right on satisfaction, right? And if the sales rep is smart, and the company is smart, I mean, then they can provide, an infrastructure in there to be able to really satisfy the information needs or whatever the doctor has, very quickly. No, okay, send a fax here, and then, I don't know, a couple of weeks later, something will happen. You can execute those sort of things right in front of them, and tell them really when it's going to be delivered. I mean, so if you push that to its ultimate limit.
But it's coming down to the sales rep. Being able to manage that relationship,
Sure.
Understand the needs of the customer.
It's the relationship manager.
Right, and the
Yeah,
technology
exactly.
serves up the relevant content.
Correct. So if they're worried, I mean, that their jobs are going away, I mean, they're not. They're just changing. They're morphing. I mean, but if you don't change with it, I mean, then the consequences will be pronounced, I think. So the access, you say, the access will be given to whoever's of most use, right? Most service, I mean, by the doctor.
I think it also gives the access a longer tail, where they're seeing the multi-channel approach that you're talking about, where the interactions within the detail could then trigger follow-up emails,
right,
communications,
exactly.
invites. So it
Gonna mesh it up together.
exactly. So it actually extends the access, beyond that call.
Well, I want to thank you, Ross and Neeraj and Boyan,
Welcome.
and thank you all for tuning in. Go to pharmafaceoff.com and let us know what you think about the iPad.